So what is the importance of positioning? So when you see the supine patient, you would see the tongue is already at an increased risk of falling back onto the oropharynx, and there is a soft palate which is also hanging around, and the oropharynx is also a muscular structure which is also once the patient loses tone, everything just falls over it, causing upper airway collapse, right? So in a supine unconscious patient, the tongue fall itself leads to a airway collapse. So in this patient, you will always need a proper positioning for intubation and ventilation. So how do you position? So you see that there should be an extension at the Atlanta-occipital joint at the C1, C2. You could see there is extension, and there should be flexion at the lower cervical flexion, like C6, C7 level. There should be flexion so that this will align your laryngopharyngeal axis in line, so that the air passage will be easier while you're ventilating, and even while you're intubating, the larynx axis would be more easier for access with your tube, ET tube or anything. So this is what is a classic sniffing position. So it improves the patency, number one, and it eases your ventilation when you're doing an unconscious patient, and it also eases your intubation because the access would be more easier. So in obese patient, this is called as ramped up position, where even if there is a slight emergency or if there is desaturation, I would suggest to prefer this particular position in an obese patient, because even if you go ahead for an intubation, you might not be able to ventilate the patient if you don't have a proper position. So position is very much important in any patient. It would be non-obese or obese, but in obese, this much preparation will be slightly needed. So you should be seeking for proper help to attain this position. And how do you know that you have attained the right position is the tragus should be above your sternal level. This is what you have to achieve, and this should not be achieved by only flexion of the neck, right? It should be achieved by having a good flexion under good padding under the shoulder, and from then you should achieve this. So this axis should be neutral to have a good patency and ventilation. As I said, poor positioning always results in a failed airway. So head tilt, chin lift. So there are three things, as we know: head tilt, chin lift, and jaw thrust. So head tilt and chin lift should only be tried if there is no cervical spine concern. If you don't have a issue that the patient would be having some C-spine trauma, if there is not a trauma patient, you would go ahead by doing these two maneuvers. If you have a slightest of the doubt that the patient would have a C-spine injury, like if the patient had a history of fall, if the patient had a history of unconsciousness, etc., if there is some history pointing towards trauma, or he had a cervical spine issue, do not try to tilt the head, right? Because this would further worsen the cervical spine injury if there is any. So, but what does this head tilt do? This head tilt, so tilting the head will again align these axes. Chin lift will open up the airway. So this is what it does. So this extends the neck and lifts the tongue away from the posterior pharynx. So what does jaw thrust do? Jaw thrust is the most important. If you ask me of all these three maneuvers, the most important one would be jaw thrust. So what does a jaw thrust do? So you would you would put your fingers under the mandible here, like if you could see in the image, and you would just slightly lift it by ½ inch. So which would lead to opening up the airway. How does it open up the airway? There will be anterior displacement of the mandible, number one, and it will pull the tongue forward without any neck movement. The tongue, which is usually an unconscious patient or any other patient, where the tongue gets slipped back on the oropharynx, right? So that it will just lift the tongue so that you will be able to ventilate the patient. Got it? So if there is any cervical spine trauma or a cervical spine concern, you would prefer only jaw thrust, and most cases that would be enough while you're ventilating. So to sum it up, head tilt, chin lift, no C-spine injury. Jaw thrust if there is a suspected C-spine injury. Both can be done, which would lead to a temporary airway opening. These maneuvers are not definitive airways, but this will help you maintain ventilation and oxygenation till you seek help. Like once you get an expert team maintaining the airway, or once you get proper ambu with a mask, or once you get a laryngoscope and tube or a supraglottic airway device, this would do the job, but not completely for the time being.